When seconds count during a medical emergency, ambulance response times can be a matter of life or death. But in Houston County, there's growing concern as some people say they face alarming ambulance shortages.
Houston Healthcare runs the system and says the shortages are part of a nationwide EMS crisis. Hunter King has more tonight on a story we have been following for over 6 years now.
High 17 should be available here momentarily.
Some people in Houston County have faced a frightening scenario, calling 911 for an ambulance that's delayed or never comes at all.
Do you have another available unit? Just be advised the patient's been lying on the concrete in extreme hip pain at the entrance to the restaurant.
They don't at this time.
Dispatch recordings obtained by our newsroom reveals cases where operators had to tell callers that no ambulances were available. We also found public records that showed dramatic differences in response times during shortages. In a stabbing last week, an ambulance arrived in just under 7 minutes after dispatch. But on the same day, an elderly fall victim waited over an hour and a half for help.
We're seeing short staffing, not only here locally, but across the state and across the nation in the EMS world.
The possible causes: an aging workforce, fewer young people entering the field, and a pandemic burnout. According to the American Ambulance Association, in 2023, turnover reached 36% for EMTs and 27% for paramedics. Houston Healthcare says they're working on the problem.
New ambulances, new patient lift equipment, and other employee enhancements approved by our Board of Trustees.
Their hiring event on Monday attracted 10 candidates. 3 are now undergoing background checks. For now, when all ambulances are busy, Houston Healthcare relies on mutual aid as the county adjusts to growth. But until they can hire more people, that aid might take longer to arrive. In Houston County, Hunter King, 13 WMAZ News.
As we told you recently, the state attorney general is considering whether to approve Emory Healthcare's plan to acquire Houston Healthcare.
A recent consultant's report said the Houston system is losing money and unable to keep up with growth. The state is holding a hearing this week to take public comment on the proposed partnership. It happens at noon Thursday at the Central Georgia Technical College Auditorium on Cohen Walker Drive.
While the county and Houston Healthcare cover many of these emergent needs, Warner Robins Fire is available to assist.
And as Houston and Warner Robins grow, public safety stays at the forefront. That's why the city spent $47,000 to get firefighters trained to become licensed medical emergency responders. They started training in February. Fire Chief Albert Wright says a majority of the department's calls are for medical support.
Now their team will legally be able to provide you more services than they currently do. While Chief Wright says it won't improve response times, it will make them more efficient overall.